Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. K. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Mom with Moms podcast. It's been a while. I was just telling Ethan over here that I haven't been in the studio in like a month. I don't know how that happened. We had our event, and then I think I was just playing catch up, and we had like some scheduling conflicts. So a little bit of a break, but that's okay. We're back now in full holiday mode, getting ready for all things Christmas and planning for gifts and lots of fun stuff happening on the momwithmoms.com. So stay tuned to the end, and we'll talk a little bit about what guides are coming, what guides are up, what to look for, and a few things that we're planning for the new year. Today, our family healthcare series continues with Hackensack Meridian Children's Health. We have Dr. Daniel, oh my gosh, I'm going to butcher it. DiGiacomo, thank you. I had it in my head. I was pronouncing it differently, but then you're like, no, it's not how it's pronounced. Okay, Dr. DiGiacomo is a board-certified allergist and immunologist. He received his medical degree from Tulane University School of Medicine, completed his pediatrics residency at Children's National Medical Center, and fellowship at Massachusetts General Hospital. Following his allergy immunology training, he joined the faculty at Massachusetts General Hospital Harvard Medical School for 1 year prior to moving to New Jersey. He enjoys treating the entire spectrum of allergic and immunologic disorders, maintaining a specific interest in primary and secondary immunodeficiencies. He is also an active participant in multidisciplinary patient care collaborations. Welcome. Thank you for joining us today. We are excited to. This is the first topic that we're talking about allergies, which is, I think I was telling you a little bit in the hallway. I usually can come into most of the topics with this series and have like a little bit of experience with one of my kids having something, so luckily we really haven't had many allergies. I don't have allergies. I really don't even get seasonal allergies somehow. Nice. I don't know how that's happened. My husband has like sensitive skin, I'd say, but he doesn't really get too much, and my kids, same thing. But we're going to delve into the world of allergies. There's probably a gazillion things that we could talk about, and so we're going to stay primarily into food allergies and kind of the different categories and why kids develop allergies, what to look for, what to do if your kids have allergies, and I'll talk a little bit about, I guess, like my brief experience. I've been under the impression for the past 8 years, my daughter's 9, that she has an amoxicillin allergy, but you're saying that's possibly not true.
Yeah, it's good though. Yeah.
So when she was a baby, I think she had pneumonia, and they prescribed amoxicillin, and then she broke out in a rash. But I'm thinking about it, it could have been a rash from the pneumonia or something. I don't know. But we haven't prescribed it since. She always gets a Z-Pak, which is different, right?
Yeah. So amoxicillin is a wonderful drug, and it's recommended as the first therapy for all these kind of different bugs and illnesses that afflicts young kids. Fortunately or unfortunately, sometimes you have a virus that kicks things off, or there's kind of an immunologic response that you have some infection, and then you give the antibiotic and you get this rash. Majority of the time it's mild, right? Resolves. And then you get labeled with, you can't have this drug anymore, which is not great in the sense that if the alternative is something like azithromycin, it doesn't work as well, always.
Okay.
And so then sometimes you say if there's truly pneumonia, it doesn't get treated as well. You're at risk for other complications, stuff like that. there was actually a guideline last year that came out in the journal, main allergy journal. It's like Drug Allergy 2022 Practice Primer Update that basically says if there's a kid who had a mild reaction, including like hives, as long as it was localized mostly to the skin, you can just, they didn't give a timeline of when you can retry it again. But usually I say like wait a year and you can like try the amoxicillin again.
Interesting.
Usually through a challenge. So you want to do it in like in a safe environment, like either at the pediatrician if they're comfortable, or in an allergist office, and you kind of usually give like a small dose and then like the regular dose and watch. And majority of the time they do fine.
To monitor what their reaction is.
Yeah.
Okay, yeah, I'll definitely look into that because
So.
it's good to know what. Obviously that if she needed, an antibiotic in the future, that she has access to it. Okay, so let's start with what a food allergy is.
So, food allergy, it's a broad term,
Yeah.
right? So in the more most common sense, it's an abnormal immune reaction, right, to a food when you're not supposed to have any, you're supposed to be able to enjoy your food and not have anything bad happen.
Right.
So, the most probably well-known sense is that you eat a food and you have this abnormal immune reaction and you have some bad stuff happen within a minute or an hour, sometimes 2 hours, and you have these kind of immediate like symptoms that can involve hives, and in more severe cases, swelling, respiratory distress, gastrointestinal upset as well. There are other disorders that fall under the food allergy realm that include sometimes more delayed immunologic reactions, and that can during diagnoses, if you've heard of FPIES, food protein-induced enterocolitis syndrome. So that's something that where you eat a food and then a couple hours later, you actually get like vomiting and hypotension. So that's like a whole, we could talk about that later.
Wow.
It's like a whole other bucket.
Okay.
And then you have your whole set of things that kind of like sometimes people call food allergy. They're not immune reactions. Maybe they're more like intolerances or something like that.
Like makes your stomach hurt.
Yeah,
and stuff
that
like
necessarily fall into, but like
You're
the bread
not,
and
like-
butter is. Yeah,
Okay, your throat isn't closing.
No,
okay.
nothing like that. Yeah.
Okay, got it.
So-
Do allergies tend to run in families?
So we were just discussing this. I think more traditionally, so we're talking about like the immediate like allergic food reaction, right? Like you have allergic antibodies, you eat a food.
Like a severe, I guess, allergy, right?
Something like that. Yes, but there's been more recent kind of investigations to this and the primary risk factors for developing a food allergy. Like on the totem pole, or like if you'd make this like big like pyramid of risk, the lowest risk people are like the general population, and then like the next risk might be someone with a family history of food allergy, but the risk increases if you have a personal history of already been diagnosed with food allergy. I guess that makes sense. But if you have other allergic conditions like eczema and stuff like that, and I think the thought process is actually changing. So traditionally, I think allergists used to believe that if your brother or sister had a food allergy, you were at higher risk because you're related closely. And now it's potentially changing to the idea that maybe your behaviors because of that sibling who had food allergy are actually one of the main risk factors. So there's been a hot topic of like when to introduce foods and when's the like safest, most reasonable time to introduce an allergenic food with the goal to prevent food allergy. And there's some thought that maybe if you have a sibling with food allergy, you might delay that process. And so you are a little bit increased risk. You might have other allergic conditions, and you wait to introduce that food, and then that's actually why you develop the food allergy. Not that the main driver is not that like sibling risk factor. It's actually delayed introduction.
Oh, so that's interesting. So let's actually pin that because I want to get back to that topic. So when you you have a newborn and maybe you're nursing or giving formula, and then you notice I guess that the baby's like having different reactions. Can babies still develop an allergy from breast milk? Like something in the breast milk?
That's a whole nother great
Okay.
topic. So yeah, so I still, when thinking about breast milk reactions, I like to still think about the whole spectrum of allergic reactions. So you can have, technically, you can have an immediate like allergic reaction where we talked about kind of like the typical hives, rash, swelling,
Right.
Or worse. Then reactions to breast milk also include some of those delayed reactions. So you can have, technically you can have FPIES, but the more classic reaction is that milk protein allergy. So you get a little bit of diarrhea, loose stool, and maybe some blood in the stool.
Right.
And that's still within the allergy realm. So that can happen. But there is still, how often does that happen? How often is like a potential food that mom's eating that goes into the breast milk the culprit of all these kind of adverse reactions? Is a good question.
Is it small though?
Yeah,
Okay.
I think so. It's generally small. Like, so they've done a lot of studies that show that food protein that mom eats can pass into the breast milk. Antibodies, not necessarily allergic antibodies, can pass into the breast milk as well. And there is a relationship between the amount of food that is consumed and the amount of food protein that gets passed into the breast milk too, they think.
Oh, interesting.
Generally speaking, you know, for if you're concerned that your kid could be having like an immediate allergic, like, you know, like this kind of like a borderline anaphylaxis reaction to food in the breast milk, it's very uncommon.
Right.
Right.
Yeah.
So usually I try to do my best not to, you know, have the mom avoid the food in her diet. And then when we think about when the kid becomes of age to eat those foods, I try not to make any big, you know, crazy decisions. Just either introduce it cautiously if there's a concern, you know, if you can pinpoint some specific food,
right.
Or we can do like testing for, you know, like for allergies and stuff too.
Okay.
Yeah.
So do most allergies then become, you know, present when the baby is introduced like more solid foods? Is that kind of when that's all? Okay. So what food? So milk, I know, is like a big one, right? Dairy, I guess. And then what are like some of the? I mean, I'm not going to ask the reasons why because I think we could probably be here for 7 hours. But what are like some of the bigger, I guess, you know, categories of food that like will you know, cause an allergic reaction?
Yeah, so a lot of it depends on age and like where you live and where you're from, what your cultural habits are.
Okay.
Generally speaking, so most food allergies present, like the peak diagnosis is probably around 1 year and before 2 years. And that's mostly like milk and egg, and it has to do with the foods that are getting introduced. Also, you know, and then high up on that list are like your peanuts and tree nuts as well. As you get older, that kind of shifts to peanut, tree nut, and like fish and shellfish are more prevalent. And then it depends on like what does your family eat the most, honestly.
Okay. Can you develop a food allergy later in life, like as an adult?
Yes.
Wow.
Yeah.
Huh. Is it like something that you don't eat like often, and then you eat it and you're like, no? It's just kind of...
I mean, I've heard it. So usually, if you are like eating a food every day or multiple times a week in like a reasonable amount, you're not going to randomly develop a food allergy.
Okay.
You know, it's like seeing situations where you're like, no, it's not that, and then like it ends up being, you know,
Right.
that. But typically, yeah, some of the situations I've seen is like, well, like maybe if you're an adult, like I ate shrimp, right? It's always like shrimp, you know, like or so like and a couple of years ago, like, I don't know, like I just didn't like sit well or something. You're like, okay, it's kind of like hard to put a finger on. Then they're like, but then I had it again last week after a year or two, and like my face blew up. And you're like, you know, like something like that. So you do see that.
Okay.
I actually had a buddy who was he was in Peace Corps. He was in Africa, and he like developed the peanut allergy like in the bush. He ate like a peanut bar and had like anaphylaxis. Yeah, it was it was a crazy story. He didn't believe it either, and he came back. He was like, "Yeah, you definitely have a peanut allergy."
Wow.
So it can happen. Yeah, I don't want people to like
No,
be worried
like,
and
scared.
afraid. But, yeah,
That's so funny. So is there research that shows that later introduction to foods can cause allergic reactions?
Yeah, so
with babies and kids.
Yeah, so a lot of it's in. Yeah, so it's not like if you're if you're adult. But yeah, you know that prominent study was the LEAP trial, right? Out of the I think it was out of the UK that showed. Forgive me if I get some of my numbers wrong, right? That if you introduce early introduction of peanut, like early and frequent and high amount of peanut introduction. In kids can like reduce the rate of development of peanut allergy by 80% by age 5, something like that. So then like this was a randomized trial. It kind of I think some of the impetus was like kind of came out of Israel too. Like everyone eats like bamba in Israel. Like the rates of peanut allergy are pretty low. So it was kind of it caused this paradigm shift of traditionally used to be delay food introduction, especially if you're high risk, because then like you could it actually increases your risk of allergy. And now and they kind of turn things on its head.
Interesting.
And then there's been a ton of studies since, right, looking at trying to reproduce that, like this early introduction to peanut, doing all the other foods, like egg and milk. Trying to introduce them at different ages and different amounts, like all this kind of stuff. And I think the general consensus is that early introduction is best.
Is best.
Yeah.
So is there a timeline? Like, it's been a while since I've had a little newborn, a little baby that I'm, that I think I can't even remember what the guidelines were then, right? I do recall it like at this 5-month mark, it was like oatmeal and the cereal or whatever, and then you kind of did like bananas and like little, So what has that changed, and what are the guidelines now?
Yeah. So the most updated. So there's been like updated guidelines, and there's a lot of more like kind of position statements, so you don't have to worry about like the differences in the allergy world, but like there's been some recent stuff there. I think a couple weeks ago, or it's not December yet, right? In October, middle
Almost.
of October, there. Yeah,
it feels like December.
Yeah,
but
right.
It's
We're
not.
almost there.
It's cold out.
Yeah, exactly. Yeah. That they came out. Yeah, they kind of updated. It was like a super updated version of like what you should do with like food introduction. And so you still maintain like the same old stuff, right? I usually say do a couple foods, make sure they can eat solid foods, between 4 and 6 months of age. Follow the AAP guidelines of kind of, either some grains or some fruits and veggies and stuff like that. And once you kind of demonstrated that's going well, then you can try to do some of these more allergenic foods. The timing, I think all harkens back to kind of some of those risk factors for development of food allergy. So if you have like nobody in the family has food allergy, nobody has eczema, like you don't have to like rush to like introduce all these foods per se.
Oh, really? Interesting.
Yeah. So
Okay.
I say my typical guidance is between 6 and 12 months, try to start to introduce these allergenic foods.
Okay.
If you have no risk factors. If you have eczema, and you're considered maybe a higher risk to develop food allergy, I would say we should really try to make sure we're cognizant and try to get these foods in like closer to 6 months as possible.
Interesting. And that includes what? Like all foods?
So yeah, so the highly allergenic foods harkens back to like the top 9 now.
Okay.
And the things I care about the most are like milk, egg, like peanut and tree nuts.
Okay.
And sesame now.
And sesame.
Yeah,
I had no
yeah.
idea that sesame, that people were even, that would never have thought that. But who knew that that's like a prevalent allergen for a lot of people. Okay. So we were also just chatting, and I'm sure this gets brought up a lot. In my generation, I didn't know anyone with a peanut allergy. I didn't. I mean, I've heard many, moms talk about this, and maybe we just weren't aware. Maybe we just didn't have friends with peanut allergy. I don't know. There was no peanut table. I know that for a fact. Yeah. And, I think when my son was growing up, that was like, it became much more common. Mm-hmm. He's almost 20. And then my daughter's 9, so same thing. It's not like crazy, but I think that there's, definitely a table and of, of kids with the allergies. So why is that? Like what, is there a finite like reason at this point why there's so many kids with peanut allergies, and and it's scary for the moms that have kids with the allergy. They always have to worry. I'm sure they have to walk around with an EpiPen, and it's not. I'm sure it's not easy being a parent with a child with an allergy like that. So let's talk a little bit about it.
Yeah, sure. I don't know if the short answer is not 100% sure why, right? But there's definitely evidence that, at least in developed countries, the prevalence or like the number of people living with food allergy has been increasing.
Okay.
And
across the board.
Yeah, across the board.
Okay.
And the number of people that have like been having more severe reactions has been increasing as well. There's some different hypotheses around that, whether it has to do with kind of our environmental practices. We talked about like the hygiene hypothesis. So, like play it outside less, right? Like having
kind of kept kids in a bubble. I mean, I'm guilty of it. I was thinking the other day how my daughter, when I was growing up, we were like, we didn't have a lot of the stuff to keep us entertained, iPads and all that stuff. So I would like go out and play in the creek, and we were like outside. We live on a street like that. My daughter can't really do that as much, and she's just like not, she plays outside a lot more at school, and we take her to the park, but it's not like go outside and play as much, So, but I also wasn't the kind of mom that was like, no, like let's like bringing hand sanitizer everywhere. Like I didn't that I don't like. So it's kind of like a mix, but definitely not as outside as we were as kids.
So that can play a role, and the whole idea is, like we're constantly being exposed to everything in our, lots of things in our environment. Our immune system seeing things, and the way it sees things, like can dictate, how we kind of call it like skewing or development of kind of like dysregulatory. I won't try not to use too much crazy terminology. Responses. So like you said, like the type of exposure to infections we get, the kind of environmental exposure, even if it's just like being outside around dirt, stuff like that, or the number of antibiotics we get. Theoretically, can maybe impact this. I don't know if there's enough compelling evidence to be like that's the reason. There's some thought too, like what if we kind of heard things because we told everyone to delay introduction of food for decades, and that could have been, there's an interesting study. A lot of awesome stuff comes out of like Australia. There's like a great group out of there, and they had tremendous uptake of early peanut introduction in their society as a whole after like the LEAP trial, and they changed the recommendations, and they looked more like an ecologic, like a population-wide study about the prevalence of peanut allergy, and it actually didn't change much.
Oh.
So it's like weird. So you get these things, right? Like these things that like you hypothesize might be due to, and it doesn't always play out as.
Is there any research about how food is made? How food has changed? I mean, I know that food in the 50s was made much differently than it's made now. Mass production and just much more, I'm sure like a lot more additives, preservatives, people, I think food primarily was probably marketed and changed on the whole in like the probably like when I was born in the early 80s, like when more moms were going into the office and we were looking for more convenience and more packaged goods, and like that's, I think that's, now I think we know to kind of shop the perimeter of the grocery store and that like Whole Foods are overall better for you, but I think that like just how we are as a country, like how food is prepared must have could have something to do with it. Is there research that says that?
Yes, I'm not as familiar with it. So I mean, there's a couple of things. The way food is processed, it's also leads into another point too. We can talk about like the way you process the food, the way your immune system sees the food. Okay. Just even if you're not thinking about, if you're just thinking strictly from like, not like processed Doritos versus like something fresh, just from like. If you're eating eggs and it's scrambled egg versus like a baked egg, like this, that's a whole other discussion.
Really?
Too. We can talk about allergenicity based on what the form of the food is. So this, but
like
this
a raw onion versus a cooked onion.
And it depends on the particular properties of the food and what specifically are you allergic to in that food, and how you can modify that food to make it more tolerant. Anyway, that's a whole, but that's like that's not necessarily, and it goes into like the development of food allergy. I feel like it's a little bit of a different discussion.
Yeah.
I mean, like processed foods, you think there's, I'm smiling because I'm like, there's some, some research into like, does it modify like just local inflammation in your GI tract or stuff like that, and change the permeability of your GI tract. So then these food allergens kind of, the way they get introduced or seen by your immune system,
almost like a
different. It just doesn't create that normal kind of process, and then something, and you're a little predisposed for one reason or the other, and then boom, you get food allergy.
Interesting.
It's a very broad overview, but there is some research that definitely is into that right now. I think it's going to get more and more hot, like in the coming years too. So.
Interesting. So your child has, say, a peanut allergy. One, is it something that you can, I don't know if this is the right term, grow out of, cure? Maybe you have something and then you just don't anymore. Does that happen? Is it treatable? What do they do?
Yeah. No, you're done. No. I feel like, peanut and tree nut allergies are very common, right? And that's why they get a lot of like awareness, notoriety.
Yeah.
I can try to think of a better word. But they're also, have been associated with more severe reactions. And they're also some of the least likely foods to grow out of. So you can grow out of food allergies. So the classic ones like milk and egg are common in kids. and they're like really important for your diet, right? But the majority grow out by school age.
Interesting.
You know,
Okay.
and there's certain things you can do. So that's when it goes back to this baked egg and baked milk. So you can alter the forms too, try to get them in the diet. There's some evidence that it helps you grow out. For like peanut and tree nuts, it's probably around like 20 to 30% grow out of peanut. Less so, like 10 to 20%, probably closer to 10% grow out of tree nut allergy.
Okay. So that's something you really live
Yeah,
with.
so usually, and like once you kind of stick with it after, you know, as you get older, you usually say you're probably not going to grow out of it at that point. Other things too is like, can the severity of the allergy change over time? You know, can your threshold, because different people have different thresholds for having an allergic reaction too. Some people can only tolerate like microscopic amounts. Some people can actually tolerate like a small, reasonable amount, just at like baseline. And I don't think we know enough yet. I think that does vary over time.
Wow.
There's other factors. We can go down the rabbit hole, get into it if you want.
Does the allergy remain because you continue to not introduce it into your body, though?
Yeah. So this goes. You can parlay this into oral immunotherapy.
Okay.
So if you've heard of OIT,
No.
So there is one FDA-approved medication for OIT. It's basically peanut powder. It's called Palforzia.
Okay.
But like a lot of academic and more so like private practice allergists have been doing this for much longer time than this drug's been approved, and with other foods than just peanut. But the idea is like you can usually get like a small amount in of the food, and then slowly increase over time.
Okay.
Like weeks and months and stuff. And that process can, well, one, desensitize you to like a small exposure, so you're not going to have like a true allergic reaction, but maybe also change the course of that allergy. There's not compelling evidence that it helped, like by doing this process, you start with small amounts, you build up, then you take a little bit of peanut every day, will actually make you non-allergic anymore, like if you stopped it. At least in the age group that it's approved for now. There is newer evidence, like this is another hot topic in oral immunotherapy, is in modifying the course of food allergies. So the thought process in general, young kids have, you're born with your immune system, you're born the way you are, but like you're more malleable, you're more pliable, your immune system can change for good or bad when you're younger, right? So if you get these foods in early introduction, if you're predisposed for developing an allergy, you can build tolerance early on, then you don't develop the allergy. So you're almost preventing it.
Oh.
There's also a thought process that if you have the allergy already and you do this oral immunotherapy in younger kids, like toddler age, then you might actually have a higher risk of changing the course of that allergy and truly growing out of it.
Interesting.
Anyways, so there's a lot of fun topics to talk about. I'm happy to talk more about
something
that.
I think similar with like RSV or COVID or the flu shot, that there was like a therapy. It was like kind of similar where like that you give like a small dose to kind of prevent actually getting it, right?
Yeah, well, there's just the antibody and vaccine approved for RSV, which is
that's
awesome.
what it was.
Awesome.
Yeah,
There's always been like a monoclonal antibody for RSV for like premature babies and stuff.
Okay.
But now there's like a vaccine. Yeah, like and it's all, and like more monoclonals are becoming available.
Okay. One of the
And it's great,
pediatricians that came on was talking about it, and it kind of reminded me like similar. She's talking about it's like a therapy versus like a vaccine, and I don't know, so.
Yeah.
Okay.
That's we can also talk about it too though, like what specific viral infections predispose you to developing allergies. But that's we could go. That's that's more like asthma realmy. But there's keep in the sense how we just go back to. It's always about like what your immune system is exposed to, right? Whether it's a virus or whether it's like peanut dust or just like dirt outside, and how that it's kind of fun. That's why like immunology can dictate how you develop, and what things go right, what things go wrong.
So having a severe allergy is probably incredibly frustrating and just like dictates your everyday life and where you go and what you consume. What are some of the things that you tell parents, like with children, that just kind of have to live like this each day, with a peanut allergy, with a milk allergy, especially in school, and just all the modifications that you have to make to your day-to-day life?
Yeah. So there's like good and bad, right? So in general, like I always start off the conversation with like, food allergy could be unpredictable, right? And like everyone has different thresholds that can change to the amount that you eat. The severity of one exposure one time might vary compared to another time. So you might just get some like tongue itching, or you could have full-blown anaphylaxis. And you parlay that with it can be life-threatening. There are fatalities. the number of people having more severe reactions is increasing. It's like, oh my God. But then I kind of shift over, right, to, there was this imperfect but awesome study from a couple of years ago that looked at the risk of death from food allergy in like the general population, and also then in a select group of people who already have food allergy, and it's like more likely that someone would die from a random accident than from food allergy. So that gives some more perspective too, right? There's like the oh my God, and then there's let's take things in perspective.
Is there more of a death rate from like bee stings than there is to food allergies? Yes.
Yeah.
Okay.
So, and that's even an interesting discussion too. Like, venom anaphylaxis more often can present with like episodes of hypotension and low blood pressure, which is a little more life-threatening, than some of this other stuff. So, general food reactions most commonly present with skin findings mostly, and then if it gets more severe, then you involve other organ systems, which can include like respiratory distress or low blood pressure. Bee sting allergy can do the same, but you see some more like low blood pressure can be a little more predominant, and those reactions can be a little more severe.
Is there any way to know that you have an allergy to bee stings before being stung?
So, you can, so like with everything, right? So we harken back into like how do you diagnose any allergic condition, right? It's like an imperfect science, but what allergists have, right? We have our scratch testing,
right?
And then we have our blood testing, and then we have our challenges.
Okay.
Right? So it's like, and you can partition, right? So you can say you could scratch test to food or specific bee venom. You can do blood tests to foods for venoms too, and then you can even challenge. We don't typically do sting challenges that much anymore, but they used to do it more frequently. Like you would like come in and you get stung by a bee and see if you reacted. It's crazy kind of stuff. It's
interesting.
But going back to foods, food challenges.
That's. So if I'm getting static from my phone here.
Oh, yeah.
The bee sting. So you can get a panel done and just get and then know exactly what you're allergic to, or is it is it finite?
I do not typically recommend it. So the guidelines actually say do not willy-nilly do the testing for venom. A certain proportion of the population will just have positive levels, and it does not, if you don't have a clear history of reacting to a sting, it doesn't necessarily mean anything.
Got it.
Even if you've had a reaction to a bee sting, it depends on what kind of reaction you had. A lot of kids, when they get stung by a bee, if they're going to have a more systemic allergic reaction, it's usually isolated to just the skin.
Okay.
So what I mean is like full body hives.
Gotcha.
Maybe some swelling.
I think my generation is all terrified of dying from bee stings because of that movie My Girl. Did you ever see it?
Wait, I think I did at some point. Yeah.
The best friend, oh my gosh, what was his name? And but he was allergic to everything. So are you more like predisposed to being allergic to bee stings if you already have other allergies?
Allergies? It depends. So some people who have severe reactions to bee stings have other underlying conditions that predispose them to severe reactions to pretty much any allergic kind of condition. It's not classically one of the things that runs with like atopy. And atopy is like food allergy, asthma, eczema, all those kind of allergic conditions. But there are situations where you could be at increased risk of all the things.
Gotcha.
That's a whole other discussion.
Yeah, but it's so interesting. I mean, a lot of the times, I think when I don't know, like you meet someone that they are allergic to. Oh, I'm allergic to everything. So, but then like you said, like there's some one person I know who's like allergic to shellfish, and that's it, and she just stays away from shellfish. But how they have to, make sure that, what's on the menu. And then, can some people be allergic to shellfish and, just by being around it? Or do they...
These are great questions.
Okay.
Yeah. So this goes into, I usually like to include some of this, too, in, the initial discussion where you're just talking about, what does it mean if I have a food allergy or whatever? What are the risks? What's going to happen to me if I get exposed to something? How can I be exposed to that?
Right.
So generally speaking, you have to eat it to have a systemic reaction.
Okay.
Some people, if you're allergic to peanut, if you rub a little bit, it might get a hive or a rash. You know what I mean? That's it, though. There's been some studies that show, if you directly inhale, a food protein, you could have a respiratory response, but generally it's just limited. You're not going to have like full-blown anaphylaxis. They've done some interesting studies. A lot of it has to do with peanut, right? Because peanut's popular. You have more severe reactions. Like I was saying, that they take like peanut and they like put it behind a gauze and like right next to somebody who's like pretty allergic to peanut, and like they don't have a reaction. Because it's a question like, if I smell the smell of peanut, can I have a reaction? And the answer is usually no.
Oh.
They've done studies where they shell peanuts around someone who's allergic, and they try to measure the peanut protein, like where it goes if it gets out there, and really not much does. So generally speaking, you have to eat the food to be allergic. The one caveat is, it goes back to shellfish actually. If you're like actively cooking a food, or if it's like in a hot soup, there's been some evidence that like it can get, like the food protein can kind of get up enough that maybe people might have more reactions. But generally speaking, I say like unless you're eating something you don't know what's in it and you have cross-contamination, like you shouldn't actually have to be worried like about, like someone can technically be eating the food next close to you and you're not going to have a reaction.
Okay.
Yeah,
Got
profoundly rare. Yeah.
Interesting. So you have a child with allergies, and they've known to be a bit more severe. Obviously, there's probably different treatment plans based on the allergy, right? But do most parents have to walk around like with an EpiPen everywhere they go? Yeah.
So regardless, right? Like once you say we diagnose you with the food allergy, we talked about how presentation of an exposure can vary. Sometimes it's mild, sometimes it's severe. Sometimes you could be in that category where you just know like you've had a profoundly severe reaction. So regardless, though, I say carrying epinephrine is the most important. So while people can have severe reactions, actually the majority of people who have reactions already been people who have been diagnosed with a food allergy, who know they have a food allergy. And it can be life-threatening. The ways you reduce all that is you know the signs and symptoms of allergic reaction, how to recognize it, and you have the treatment available.
Got it.
Is treatment for anaphylaxis for severe food reaction is epinephrine.
Okay.
Right, that's it, right? Epi auto-injector. And we always say you should carry 2 with you at once. So pretty much every time you order, or if epinephrine is like sent to the pharmacy, you get like these 2 packs. And so the idea is that there's a very low % chance, but sometimes like if you're having bad anaphylaxis, you give epinephrine and the symptoms persist or they come back after they went away, then you might need a second one.
Got it.
So we say always carry epinephrine if you have a food allergy. Always carry 2 that are unexpired and that are like physically with the person who has the food allergy.
What is it is this for any drug, but we'll ask specifically for an EpiPen. If it's expired, is it just less effective or does it like spoil?
A little bit of both.
Okay.
Honestly, I don't know if I'm allowed to say. Like, if it's been stored in a good position, like
I've always wondered about
that.
Yeah.
So what I try to still kind of say is, if it's been stored properly, some people like leave it in their car in these like huge swings in temperature.
In the heat.
Yeah, you know what I mean. You're like,
yeah.
And it's like not like, it's less than a year expired, and you look in the little window and it looks clear. Like, what your options are, like, don't give that drug that's probably not very, it's going to work. Maybe it's a little less effective. It's not going to be unsafe, even though it's technically expired. Or see what happens, like if you're having. So I usually say, if there's an EpiPen around, if it's like not too old and it looks like it's still good, I just give it. Yeah.
Okay. We'll talk quickly about eczema, because that is really challenging for a lot of people, right? In general, kids, adults that have it. Is it specifically food related? Psoriasis too, right? Or no, not so much. It's eczema.
I think eczema is mostly food-driven eczema. It's like not the bane of allergist existence, but it creates some of the most difficult discussions, right? So. To harken back, like the main risk factor for development of food allergy is probably eczema.
Okay.
So that's why, just in these individuals in the first place, making sure you get as many foods in that are considered highly allergenic and making sure they tolerate them is like super important.
Okay.
Those are the kids that will develop food allergy if they're gonna.
So will you develop eczema and only eczema if you have a food like any allergy, or can you have eczema and like not have?
Yeah.
So it depends.
Yeah. So it's just you just say it serves as like a risk factor. It
Got
doesn't
it.
necessarily you're not going to definitely develop a food allergy or not. It just these are the kids, like when we talk about early introduction, you want to start at like the earlier range when they start to introduce foods and stuff like that. Now there's this whole group of kids that have eczema. You start to introduce the foods, and then they get eczema flares. You know, like, or you know, as the allergist, you see a kid and they have terrible eczema. No one can get control out of it. And they're like, I notice it gets worse every time he drinks milk. You know, so then you're dealt with a scenario of like, what do we do? Because this kid's at high risk of like developing an allergy. Probably if you pulled the milk out, you have
continue
to continue it. He might actually then develop that immediate allergy versus the eczema.
Right.
Or like, do you just keep it in? And, you know, so there's been a lot of stuff surrounding this. There's like a guideline that came out in 2022 that really tried to tackle this. So first you have to differentiate between the different kind of like skin reactions, right? So in response to food, you want to make sure that the reaction to the food is not like an immediate allergic reaction. Like the kid's not like eating a food and like 20 minutes later it like breaks out in hives. You're like, you know what I mean? Like, you should get skin tests and stay away from that food.
Okay.
But if it's a couple hours later, you know, you notice the eczema gets like so much worse. The kid's like itching and scratching, you know, and you're trying your best to control it, and like it just won't. Like, that's a different situation. So there's probably it's been shown too that to further complicate things in these kids, you're like I said, like, you're increased risk of developing a true immediate allergic like symptom, and they're also, when you do the typical allergy evaluation, you're like going to be more likely to be like positive for all these foods, which further complicates like, what do you do in this situation?
Right.
If that makes sense. It's a complicated kind of discussion. So this guideline 2022 kind of went like through the steps of like always making sure you try to take care of the eczema as much as possible first. There's actually not too much evidence like in trials that show that if you remove a food from the diet, it will improve the eczema.
Yeah.
And there's like a significant small improvement, but not long-standing.
Interesting.
And then you couple that with, there's been demonstrated that kids with eczema, even if you tolerate the food before, then pull the food out, you might then become allergic to it afterwards.
Interesting.
So it's like...
Do you treat eczema, or you? Yeah. Oh, you do? Okay, got it. Has there been any advancements with eczema, or is it kind of just
for eczema care. So there's been a lot of advancements for like adults and treatments. You see, I don't know, for like all the commercials for like a Rinvoq, like these oral Jackanibs. But in the kid world, probably one of the more recently approved medications, or one of the more popular and recently approved, is Dupixent. It's approved down to 6 months of age. For kids with eczema. It has lots of other indications. You might have heard of it for eosinophilic esophagitis, asthma, for older kids or adults, chronic sinusitis with nasal polyps, prurigo nodularis, all these kind of things. There's lots of indications for it. But it's a good option in kids who have like severe refractory eczema that you can't figure out what's going on. You've done, like proper management. But Dupixent's again, all these things, there's so much to talk about. Like, it's a whole other discussion.
Does food allergy induce asthma? Or they kind of like one is not the other?
They're definitely related, it's going to be part of that atopic march, which is a more traditional kind of thought process. Like people who are going to develop atopic disorders can get like eczema, then you get food allergy, then you get asthma, then you get allergic rhinitis and all this stuff, and it's all related, right? It's all kind of like this abnormal allergic response to things in our environment, whether it be a food, whether it be like a pollen, and stuff like that. The important aspect too about asthma is, so for some kids, who have food allergy can sometimes be misdiagnosed as asthma. It's uncommon, but like they can be present with recurrent asthma attacks. You don't realize you're eating a food each time. And
Interesting.
Yeah, so I've seen cases of that too.
Okay.
So that's something to keep in mind.
Yeah, absolutely. Yeah. So if your child is maybe had a bad allergic reaction, or you find that they're showing signs of having some type of allergies, obviously go to the pediatrician, right? Where can they make an appointment to find you? The great new allergist in Monmouth County.
Yeah, right. So I'm at Hope Tower at Jersey Shore Medical Center in Neptune.
Yeah, it's beautiful there.
Yeah,
it's a really nice building.
Right? Yeah,
it's very swanky. I loved it there. We were there for my daughter was seeing a doctor there, so we spent a little time there like a couple of years ago, and it's really nice. So there's a lot of great things happening there with Hackensack Meridian Children's Health. Thank you so much for answering these important topics. I think we could probably have you back on and just talk about more
do.
go on to all kinds of different layers, right, of
course.
allergies. But I think we tackled some important questions about foodborne allergies, and I learned a lot, I know. So I hope that it helps some moms out there, and you can take this and help your families. Coming up, we have the Holiday Fun Guide happening right now, so make sure to check that out for all things holiday related in Monmouth County. This season, we have where to get your Christmas tree, local holiday events, Christmas tree lightings, different plays, shows, theater productions happening to see Scrooge and Polar Express and all kinds of fun productions throughout the area. And we also have where to go ice skating, so pretty much everything holiday in a bubble, right, in Monmouth County. So make sure to check that out. We also have our holiday shopping guide. I love to support local this time of year. There's so many great local businesses that have you covered for everything in the family. So there's lots of great shopping gift ideas, especially last minute. Local's great for last minute too, right? If you can't get it shipped in time, head out and check out all the shops listed in there. And then right now we're working on updating our fall catering guide to reflect all the holiday menus. So, I think this will be next week. So the first week of December, get all of those orders in for holiday parties, for friends, for bringing in for hosting, and also for bakeries too. So we have a lot of cool stuff in there. And as always, make sure to check the monmouthmoms.com for the latest resources, events. We have 2024 Monmouth Mom Summit happening. So I'm going to talk a little bit about that next time, but keep following us for updates. We have a lot of exciting things planned for the new year. So stay tuned and enjoy the holiday season, everyone. Have a good day.